Hey students, sorry for the late hour. Unfortunately my plane was delayed and I could not get this to you sooner, but I did want to get you a little video before you did your exam tomorrow, because oncology is where I have spent the last 7 years of my career and it is kind of my area of expertise, and I wanted to provide you a little extra info to help you with your test and also help you with your future patients. So hopefully this is very useful for you. I wanted to start by explaining how chemo works exactly. Chemo is not a targeted therapy. It doesn't know which cells are cancer and which cells aren't. The way that the medications work is they attack certain parts of the cell division cycle. So cancer cells divide really quickly, and that's why they are affected by the chemo, because they're constantly dividing and it's attacking their division. Unfortunately, there's other cells in our body that are good cells that divide very quickly as well. Those cells are your red and white blood cells, platelets, skin cells, mucous membranes, hair cells. All of those cells grow and divide quickly and replace themselves quickly, and that is why chemotherapy side effects come in. So if you think about side effects from chemo, you have nausea, diarrhea. Those are coming from the mucous membranes in the guts being damaged. You have mouth sores from your oral mucous membranes being damaged. You have hair loss. You have sometimes skin issues and nail issues with certain chemos, where your nails get damaged or your skin actually sloughs off from your hands and feet. Those are all side effects of chemo that come from those cells getting attacked during the cell division cycle. Your red cells, when they're killed off, that leads you to have anemia, which causes weakness, shortness of breath, extreme fatigue, and your platelets can get low, which gives you easy bleeding and easy bruising. And your white count can actually get down to 0 from a lot of chemos, which makes you super susceptible to infections. So when you're thinking about the chemos, some of those side effects are specific to certain chemos, but generally those are all possibilities with almost every chemo. So when you're educating your patient, one of the first things you want to educate them on is what chemo are they getting. What does the treatment look like? So for example, I currently have a patient who has B-cell lymphoma. She gets a 5-day cycle, so all day long for 5 days. Hers is a 24-hour. She is getting chemo infusion. Day 1 is the day that we start it. After the 5 days, she goes home, she lives her life, and on day 21, she comes back and we start over that cycle too. Some chemos are in the infusion center outpatient. You just go in. Lung cancer usually gets carbo and etoposide. You get 3 days of chemo in a row, and then you come back in 3 weeks or 2 weeks, depending on what the actual oncologist orders for you. So you explain their plan to them, and then you want to talk to them about side effects. I think it is extremely important as a nurse, as a patient advocate, to teach your patients how to be advocates for themselves, because you're not going to be with them at home, and they need to know how to take care of themselves when you're not around, and they need to know what's a problem and what's not a problem. A lot of people expect to feel bad when they're getting chemotherapy. When I was a kid, if you heard that someone was going to get chemo, you expected their head to be in the toilet the whole time, just like feeling terrible. And luckily, we've come a long way since then in terms of managing side effects. And so now the first thing I always tell my patients is you should not expect to feel bad. If you're feeling bad, you need to talk to your doctor and your team, because there are so many ways that we can help, and we don't want people to suffer needlessly. Like, we have options to help them, and if one thing doesn't work, we have another plan in mind. So the first thing you want to do is just tell them, like, they need to communicate with their team when things are not going right. Teach them what anemia and low platelets and Teach them what that looks like. How do you prevent bleeding? You use soft toothbrushes. You don't use a straight razor, just an electric razor. And be extra careful, like careful for falls. If you do cut yourself, lots of pressure on that for several minutes, because it's going to bleed. In terms of the anemia, since we know it's likely, need to teach them what symptoms to watch for so that they recognize it when it comes and they know to call and say, hey, I'm going to need some blood. So those are things that you want to teach them to recognize. As far as the white blood cells and the neutropenia, there's not really anything we can do to prevent it. We do give a medication called Neulasta. That's a white blood cell stimulating factor that helps the bone marrow produce more of them. Sometimes it works, sometimes it's not as effective as we would like, and someone still gets neutropenic. But we want to teach our patients to plan for that so that they can be preventing infection from the get-go. We don't want them to get sick while they're on chemo because it makes everything a lot harder. So teach them everything we learned in COVID, lots of hand washing, don't let sick people come around you. If someone is like a teacher at school or has kids in school, they should wear a mask if they're around, just because there's so many germs in school, like we know. They should actually, this is one of those things that's kind of counterintuitive for some people, want to avoid fresh fruits and vegetables. It's a low risk, but if you think about how many times you've heard salad being recalled for E. coli, that's why. We don't want them to take a chance of getting bacteria through their food. We also want to tell them to avoid large crowds and to get as a daily multivitamin to help them have a stronger immune system. As far as the other side effects, a lot of these are common problems, but they tend to be a little bit extreme when you're going through chemo. So constipation and diarrhea, there's over-the-counter remedies for those. Your patients are allowed to use those. Let them know that, if you're constipated, try some Miralax or some prune juice. If you're having diarrhea, try Imodium. If that doesn't work, you call your team, because then we give you the prescription strength. Same with nausea. Your patient will be going home with usually several nausea meds. If they don't work, though, there's other options. One of the things that surprises a lot of people is, besides your typical nausea meds, we use Ativan, Haldol, and Zyprexa, which are all psych meds, to help with nausea. And part of that is because one of the ways that people get nausea from chemo is actually through a different pathway than like stomach-related nausea, because you're expecting the nausea. We call it anticipatory nausea. And so those psych meds can actually help with the nausea. We also give steroids before we start the chemo, and the steroids help with nausea as well. So we do a lot of things to prevent it, but we want to make sure our patients have options to help treat it if it comes. Mouth sores, we advise them don't use any alcohol-based mouthwash. We recommend Biotine. Instead, the alcohol can break down those mucous membrane cells even more, and it burns a lot if you have a mouth sore. So just kind of these things, like we work with them on skincare, make sure that they're, applying lotion and doing what they can to take care of their skin. Some chemos can cause sun sensitivity, so we remind those patients that they need to stay out of the sun. Some can cause cold sensitivity, like to the point that you can't go outside in the winter without being super bundled up, and you can't drink ice because it's very, very painful. So knowing your specific chemo regimen and those side effects, we address those specifically. So kind of the main idea, any new cancer patient, is you want to let them know what to expect. You want to let them know how to advocate for themselves at home. And then you also want them to know what resources they have. So I know at SUMA and sure at other places, At our chemo infusion center, which is where all the outpatient oncology care occurs, we have dietitians, we have spiritual care people, we have social workers, we have all kinds of people over there that are part of the team that can help when things come up. So let them know what all those options are, and make yourself aware of what all those options are, because it's really helpful for your patients to know about those things. The dietitians, for example, they have a whole book that goes through every kind of chemo and how it affects the taste, and it has like lists of foods that the patients should try to eat that might be easier for them to tolerate than other things. And like I said earlier, it's counterintuitive. People think, oh, you need to eat really healthy because you have cancer and you're getting chemo. But honestly, our vote is eat what you can eat when you can eat. And if it's potato chips, I'm cool with it. So we want them to get calories. Their body is working so hard to fight the cancer. So we want them to get calories, and we don't really care where they come from as long as they're getting them. I always recommend protein shakes if people can tolerate them, because the protein is really helpful keeping their albumin levels up. But like I said, we take what we can get with these patients because a lot of them have trouble eating. And the last thing that I want to teach you about oncology care is this is an area where you're going to probably see your patients a lot. They're going to come in several times during their care, whether it's for chemo or they're just having side effects or they're having complications, and they're having surgeries, whatever it is, but you're going to see them frequently, and you're going to develop rapport with them, relationships with them. And this is one of the reasons I love working in oncology, because these patients invite you in, they let you be part of their lives, they let you share this journey with them. And so compassion is hugely important with these patients. They need to know that you're there for them, you've got their back, you're cheering them on. If they are having an awful day, you make them laugh or you let them cry, whatever they need. You got to learn to read them and figure out what it is that they need. But being that person for somebody, honestly, is why I became a nurse. But it's an incredible thing to do. And if you've ever gone through illness or had a family member go through illness, you probably know that, how much that helped you. And so just kind of think about that with these patients, because cancer is kind of a humongous, like, take a breath in and hold on to it for a bit and try to figure out where to go from here kind of diagnosis. And these patients count on us because the doctors are really good at saying, this is what you have, this is what we have to do. The nurses are the ones who come in and pick up the pieces and teach them how to manage it and help them figure out how to manage it and help them figure out where to go from here. So that's going to be on you guys one of these days, and I hope that you will do a great job with it, and I hope you do a great job on your tests, and I will see you tomorrow. Bye.